So, if you're listening to this right now, there's a very good chance you're either in pain, like right this second,
Or you've been there.
recently.
Exactly. Or
Mhm.
you're living in that state of absolute terror that your back is going to go out again. And I want to start by saying you are in very, very crowded company.
Mm-hmm.
We're looking at a stack of research today that paints a pretty staggering picture. Low back pain isn't just an annoyance. Globally, it's the leading cause of years lived with disability.
It's the heavyweight champion of health problems. It's almost the universal human condition at this point.
Universal is the word.
The statistics are relentless. About 84% of adults will experience it. It's basically a rite of passage. If you haven't had it yet, just wait.
Thanks for the optimism. But honestly, 84% is wild. It makes you realize how maybe design flawed we are as bipedal creatures.
Maybe so.
But here's the thing that actually got me excited about this specific stack of sources we're diving into today.
Yeah.
We aren't just looking at the doom and gloom.
We have a very specific mission for this deep dive. We're trying to build a roadmap, a patient education guide, effectively based on the absolute latest data. And I mean latest. We've got systematic reviews from 2025 in here.
That's right. And the goal isn't just to dump data on you. The goal is to move you, the listener, from that state of fear and confusion
Which is exactly where you live when your back locks out.
to a place of empowerment. We want to break down what low back pain actually is, how to change your future, and specifically what to do when those symptoms strike. Because that what to do has changed a lot.
It really has. And I think we need to start by shattering some myths, because I grew up thinking, and I think most people did, that if your back hurts, the prescription is simple.
Lie down.
You lie in bed, you don't move, and you wait. But looking at these global clinical guidelines, that seems to be completely wrong.
It's practically the opposite of what you should do.
Yeah.
But before we get to the tactics, we have to set the stage a little. While low back pain is incredibly common, the prognosis, the outlook, is generally favorable if it's managed correctly. The spine is much stronger than we give it credit for.
We treat it like it's made of glass.
We do. But it's really more like a suspension bridge. It's built for load.
Okay, let's unpack that. Because when people go to the doctor, they often get hit with a term that I find incredibly frustrating. Non-specific low back pain. To me, non-specific just sounds dismissive. It sounds like we don't know what's wrong with you, so go home.
I hear that frustration all the time. It feels like a non-diagnosis. But let's clarify what non-specific low back pain, or NSLBP, actually means. It is. It's actually a good thing.
A good thing? How?
It doesn't mean the pain is fake. It doesn't mean we're clueless. It simply means we have ruled out the sinister stuff. The pain isn't caused by a specific dangerous pathology like a fracture or a tumor or a severe infection.
So it's basically a way of saying your spine isn't collapsing and you don't have a disease.
Exactly. It means the structure is intact, but the mechanics, the muscles, the joints, the discs, are irritated. It's a mechanical issue, not a disease issue. And this is where the research gets fascinating, emphasizing something called the biopsychosocial model.
Okay, that is a massive mouthful.
Yeah.
Biopsychosocial.
It is, isn't it?
I feel like that's one of those words academics just use to sound smart. So what does it actually mean for someone whose back is, killing them?
It means we have to stop looking at back pain as just a biological issue, like a broken car part. It's biology, yes, the tissues, but it's also psychology and social factors, stress, lifestyle, sleep, and crucially, fear.
Fear.
A huge factor. Think of your pain system like a fire alarm. The biology, maybe the strained muscle, is the smoke. But your stress level, your anxiety, your fear of movement, that's the volume knob on the alarm. You can have a tiny bit of smoke, but if you're terrified you're damaging your spine, your brain turns that volume knob up to 100 decibels.
So the pain becomes disproportionate to the actual injury.
Precisely.
That brings us to what I think is the biggest aha moment in this entire stack of research. Our obsession with imaging. We think, I need an MRI. The MRI will show the smoking gun. But the data says, not really.
This is the hardest pill for patients to swallow, but it is the most important.
Yeah.
Imaging is often incredibly misleading.
How so?
We have studies where you take 100 people off the street who have zero back pain, completely pain-free, and you put them in an MRI scanner.
Right.
A huge percentage of them will show abnormalities.
Like what?
Disc degeneration, bulging discs, arthritis, things that show up on scans of people who are running marathons and lifting their kids without a twinge of pain.
So wait, if I get an MRI and it says disc degeneration, you're saying that might not even be why I'm hurting?
Correct. The expert consensus now is that hurt does not always mean harm. Just because you see a degenerated disc on a scan doesn't mean your back is broken. Think of those findings like wrinkles on the inside.
Wrinkles on the inside. I like that.
You get wrinkles on your face as you age. They don't hurt. You get wrinkles on your spine. They often don't hurt either. They are signs of life, not signs of fragility.
It's reassuring. But, and here's the big skepticism check. It's hard to internalize my spine is robust when I'm lying on the floor unable to put my socks on.
Of course.
So let's get practical. The listener's asking, okay, great, my spine is strong, but it hurts right now. What do I do? We need a timeline.
Right. We need to distinguish between two very different phases. Phase 1 is acute pain. That's the first 4 weeks or so. Phase 2 is chronic pain, anything lasting longer than 12 weeks.
And the playbook is completely different for each.
Completely different.
Okay, let's start with phase 1. Acute. You're unloading the dishwasher, you bend over, and SNP. You're locked up. Panic sets in. What does the evidence say you should do in that exact moment?
First rule, do not stay in bed.
See, that sounds insane. Every fiber of my being says don't move.
And that's your brain trying to protect you, but it's misguided. The guidelines are unanimous on this. Prolonged bed rest actually leads to a slower recovery.
Why? What does it do?
It makes you stiffer, your muscles get weaker, and that fear volume knob gets turned way up. You want to stay active, as tolerated.
As tolerated is a tricky phrase, though. Does that mean I should grit my teeth and power through agony?
No, absolutely not. We aren't saying go for a run. As tolerated means go about your daily life as best you can. Walk around the house, make coffee. If pain spikes, rest for a bit, then move again.
You're trying to show your nervous system that movement is safe?
You are.
Okay. What about symptom management? Because I'm not just going to walk around smiling. I want relief.
For immediate relief in that acute phase, the research points to superficial heat. A simple heat wrap or hot water bottle. It has moderate quality evidence, which in the back pain world is actually pretty good.
Heat, not ice. That's always the big debate.
Heat tends to relax the muscles and reduce that guarding tension. Ice can sometimes make things stiffer.
And for the medicine cabinet?
NSAIDs like ibuprofen or muscle relaxants are the first-line options just to help you keep moving. But, and this is a big one, systemic steroids are a no-go.
Really?
The evidence shows they just don't help for this type of acute back pain.
Okay, so phase 1 is heat, maybe some ibuprofen, and keep moving. But let's say it doesn't go away. We cross that 12-week mark. Now we're in phase 2, chronic low back pain.
This is where the strategy has to shift. In the acute phase, we were managing symptoms while the body healed. But if pain persists past 3 months, it's rarely about tissue damage anymore.
So what is it about?
It's about the nervous system being stuck in alarm mode.
All right.
So passive treatments, like just lying there with a heat pack, they need to take a back seat. They might feel good for an hour, but they don't fix the problem.
You have to move to active treatments.
Exactly.
And I noticed in the guidelines, there's a very stern warning about what not to do here.
Yes. Opioids. The guidelines are very clear that opioids should be a last resort if used at all. The risks are incredibly high, and for chronic back pain, the benefits just aren't there compared to other options.
And no more scans.
And stop looking for new imaging. If you've had pain for 3 months, another MRI usually isn't going to give you the answer. It's just going to show you those wrinkles and make you more afraid.
So if pills and scans aren't the answer and passive stuff isn't a cure, what's left?
Exercise therapy. It is the gold standard. It reduces pain and disability more effectively than usual care across almost every study we looked at.
Okay, so exercise, but that's such a broad word, right?
It is. It's almost meaningless on its own.
It's like saying eat food. You know, the listener right now is going, great, exercise, what kind? Because I think there's this assumption you need to go lift heavy iron to build a steel back.
Right. But looking at the exercise money from the very latest 2025 data, that's not really the winner, is it? We're looking at a massive analysis where researchers crunch hundreds of studies together to see what actually wins. They use something called a SURA.
SUCRA. Sounds like a villain in a Bond movie.
It does. But think of it like a probability rating in a horse race. A high score means the treatment is beating almost everything else for pain relief.
And the horse that won?
Tai Chi.
Tai Chi. Really? I mean, no offense to Tai Chi, but it looks really gentle. How is that fixing a chronic back problem?
That gentle nature is exactly why it works. Chronic back pain often destroys your proprioception. Your body's ability to know where it is in space. You feel clumsy, stiff, disconnected.
Mm-hmm.
Tai Chi is all about slow, controlled, mindful movement. It forces you to reconnect your brain to your body.
So it's recalibrating the machine.
Exactly. It combines movement, balance, and that mind-body connection.
Mm-hmm.
It addresses the fear of movement because it's non-threatening. It turns the volume knob down on the alarm.
It's sneaking movement in without terrifying your nervous system. Okay. Another big one in the literature is Pilates and motor control exercises.
Right. And this is often what people think of as core strengthening. But we have to be careful.
Why is that?
People hear core and think six-pack abs. They do 1,000,000 crunches. That is not what we're talking about.
So crunches are out.
Crunches work the outer muscles. Motor control exercise, or MCE, is about retraining the deep trunk muscles. Imagine a natural corset wrapped around your spine.
Uh-huh.
In chronic pain, those muscles often fall asleep, or they fire too late.
It's like the stabilizers are offline?
Precisely. Pilates and MCE wake them up. It's about coordination and stability, not just brute strength.
Yeah.
You're teaching the spine how to support itself again.
Okay, so we have Tai Chi, we have Pilates. But I'm thinking about the listener who's saying, I'm not going to a Pilates studio. I'm definitely not doing Tai Chi in the park. What's the accessible option?
Walking. And this is really exciting because for a long time the data on walking was a bit mixed. But a new study from 2024 sheds new light on this.
This was the individualized walking program study, right?
Yes, and the key word is program. They didn't just tell people go walk. They gave them a progressive schedule. Start small, build up, and combined it with education.
Education seems to be the secret sauce in all of this.
It is. The study participants were taught why they were walking and that it was safe. When you combine the physical act of walking with the mental knowledge that this is healing me, it significantly reduced the recurrence of low back pain.
It's low cost, no equipment, do it anywhere.
Exactly.
But I have to play devil's advocate here. If I'm in pain, walking hurts. How do I start?
You start with graded exposure. If walking 20 minutes hurts, walk 5 minutes. If 5 minutes hurts, walk to the mailbox and back. You find the baseline where you feel safe and you just nudge it forward.
You prove to your brain that you can do it.
That's the goal.
Okay, so we have our menu. Tai Chi, Pilates, walking. Now we need the prescription. The dosage. How much do we need to do? Because I think there's a tendency to think if some is good, more must be better.
The no pain, no gain crowd.
Right. I need to do it every single day for an hour.
And the data says, stop right there. A 2025 systematic review actually looked at frequency. And they found a sweet spot.
What's the magic number?
3 to 5 sessions per week.
That is surprisingly manageable.
It is. And interestingly, doing it 7 times a week wasn't necessarily better. In fact, some research suggests a U-shaped curve.
Describe that curve for us.
Picture a U. On the left side, you have inactivity doing nothing. Pain is high. On the far right side, you have excessive activity elite training, no recovery. Pain is also high there.
Overload.
Right. You want to be the bottom of the U, the moderate middle ground.
And how long do these sessions need to be?
Also very manageable. The latest analysis suggests that sessions of 15 to 30 minutes are highly effective. You don't need to spend an hour at the gym. A brisk 30-minute walk is potent medicine.
Consistency, though, seems to be the real key here. You can't just do it for a week and say, well, this is bogus.
Correct. Tissue adaptation takes time. Neural pathways take time to change. The data shows the best long-term changes happen when the intervention period is greater than 16 weeks.
So a few months.
You have to view it as a lifestyle shift, not a quick fix like a pill.
Okay. So 3 to 5 times a week, 20 minutes a pop, stick with it. That sounds like a plan. But I want to pivot to the future because that other scary stat is recurrence.
It is high. About 70% of people who have an episode will have another one within a year. It's a relapsing condition.
That is just depressing. It feels like you're just waiting for the other shoe to drop. Is it inevitable?
No. We can get off the ride. This is where a big meta-analysis gives us a lot of hope. It showed that exercise alone reduces the risk of recurrence by 30%.
30% might not sound like 100, but in the medical world, a 30% reduction in disability is massive.
It's huge. If there was a pill that did that with 0 side effects, everyone would be taking it. The recommendation for prevention is a combo of strengthening and stretching or aerobic exercise 2 to 3 times a week.
Maintenance mode.
Exactly. So once you're out of pain, you don't stop. You keep that maintenance dose going.
And again, it comes back to the mental aspect too, doesn't it?
It has to. The prevention isn't just physical. It's understanding that pain does not equal damage. When you get that, You're less likely to spiral into a panic the next time your back feels a little twinge.
That's a crucial distinction. Feeling a twinge and thinking, oh no, I'm broken again, versus feeling a twinge and thinking, okay, my back is sensitized, I need to move gently.
That difference in mindset is often the difference between a 2-day recovery and a 2-month disability.
So let's bring this all together. Imagine our listener is currently on the carpet, staring at the ceiling, wondering what to do next. What's the summary roadmap?
If you're in the acute phase, it just happened. Do not panic. Use heat, maybe some over-the-counter anti-inflammatories if that's safe for you, and keep moving as much as you can. Do not stay in bed.
Your spine is safe.
Your spine is safe.
And if you're in the chronic phase, it's been nagging you for months and you're scared to move.
Then you need to pick something from the exercise menu. Tai Chi to fix your body awareness, Pilates to wake up your core, or a structured walking program to build confidence.
Aim for 3 to 5 times a week. Keep the sessions manageable.
15 to 30 minutes, and stick with it for the long haul.
And for everyone listening, regardless of pain levels,
Remember that your spine is strong, it's adaptable. The best chance you have to be pain-free is active engagement. Passive waiting rarely works.
I love that. Active engagement. Now, before we sign off, I want to leave the listener with something to chew on. You mentioned a word earlier, kinesiophobia.
Yes, kinesiophobia, the fear of movement.
So I want to ask you, the listener, is it the back pain that's stopping you from moving? Or is it the fear of the back pain?
That is the provocative thought. Because the evidence suggests that for many people, the fear is actually more disabling than the tissue injury itself. Conquering that fear, learning to trust your spine again, is often the very first step to actual healing.
Trust your spine. It's stronger than you think. Thanks for joining us on this deep dive. We hope you feel a little more empowered to move today.
Keep moving, everyone.